When we initially evaluate a child with toe walking, uh, we need to evaluate why it happens. Okay, so the differential diagnosis for toe walking ranges from uh, toe walking, which is part of the normal development, like we already told, to toe walking due to congenital conditions, acquired conditions, neuromuscular conditions, neurological conditions, muscular dystrophy, cerebral palsy, spinal dysraphism, tethered cord syndrome. So there are many different causes why toe walking can happen. So basically, you need to exclude everything else, and when you exclude everything else, we can call it idiopathic toe walking. Okay, so what we see is in a majority of cases where there is no other cause, a lot of these children suffer from autistic spectrum disorder. Okay, however, I am not trying to tell here that autism is a cause of idiopathic toe walking, but in children with idiopathic toe walking, a lot of these children have some form of autism spectrum disorder. Okay, now when do we get these children? Now, as you know, that normal walking starts at the age of 10 months, and most children who are having some sort of congenital acquired or neurological conditions have a delayed gross motor development. And these children generally start to walk by, say, about 15 to 18 months of age, at which time they realize that the children are walking on their toes. So, children generally present by about 18 months when their parents are concerned why the child does not have a normal heel strike while walking. Okay. So, at that age, at about 18 months of age, we can actually observe most of these children because it can be part of the normal development. But if this toe walking persists after the age of 3 years, okay, then definitely most of these parents who bring their children in are valid in their concerns to bring them in at this point in time. Okay. However, children who continue to toe walk beyond the age of 5 years are described as having a persistent idiopathic toe walking. Okay, now persistent idiopathic toe walking is used to describe this toe to toe pattern and can include both children with and without a contracture at the ankle. Okay, so basically, we need to know that at 18 to 3 months, 18 months to 3 years, they can present to us. Most of them can resolve spontaneously, but children who are more than 5 years of age are called persistent idiopathic toe walkers. And for them, we need to do a complete battery of investigations and they require certain treatments on their own.